So the second muscle is in the front of the forearm is the brachialis, and this is a grunty, deep muscle. It sits underneath the biceps, so I can't even really draw it. It attaches to the humerus about here, and it's deep, but the difference between it and the biceps is that it comes and it joins into the ulna. So the brachialis attaches to the humerus, it spreads out, and then you have a very big, strong tendon joining into the ulna. And so this is a very simple muscle. All it does is it flexes the elbow. Now this muscle has a series of triggers which are down in the lower, which is again in the biggest belly of the muscle. So they're lower than the biceps triggers. They're here, here, and here. And to get there, you have to pull the biceps across and tuck your finger underneath, like that. And you dig in. It's quite a tender area. The triggers from the brachialis occur where the muscle is, occasionally refer proximally, but the lateral triggers actually refer over the lateral epicondyle. So one of the causes of tennis elbow or of lateral elbow pain, which is such an incredibly important recurring problem that people present with, one of the causes is in fact a brachialis trigger, lateral brachialis trigger. Difficult to find, so if you're just squeezing around in the biceps, you miss it. You have to move the biceps across, tuck underneath, and the person nearly dies. So that's very, very important. Of all the triggers in my experience, the most important of the triggers in the front of the arm is in fact this lateral brachialis trigger. So to treat it, again, pull the muscle over, feel backwards and forwards because the long axis of the muscle is running in this direction. So I'm playing backwards and forwards, feeling for that tight band. Once I find the tight band, I move up and down a bit until I find the trigger point itself. I'm watching his face. He says, "Oh my God, that's the point," and will often, when I'm on this, say, it's in my elbow. And at that point, I use ischemic principles, push hard enough to cause pain, and then slowly reduce, increasing the pressure while staying in the pain-free zone. Once I've done that, well, I can also use cold. Cold doesn't work as well here unless you actually pull the biceps out of the way, and then from origin through here to insertion, but also over pain zone. Origin to insertion over pain zone, like that. 2 or 3, and then the stretch for the brachialis is just a simple extension of the elbow. You follow that with local heat, and again, one more stretch. So there you have the brachialis muscle, and remember the lateral lower trigger, which refers and is one of the causes of lateral epicondyle pain.